When someone is struggling to breathe, every single second feels like an eternity. So today, we're going to dive into a truly powerful medication that can flip the script in a matter of minutes: Racemic Epinephrine.
You know, if you've ever heard it, you never forget it. That scary, barking cough from a child who just can't catch their breath. In that high-stakes moment, what's the one thing that can bring relief almost instantly? Well, for a lot of clinicians, the answer is Racemic Epinephrine.
So what exactly is this stuff? Well, it's what we call a sympathomimetic drug, but let's break that down. Think of it as a synthetic version of adrenaline. Its entire job, its whole mission, is to act as a super powerful bronchodilator, which is just a fancy way of saying it opens up those tight, constricted airways, and fast.
But how on earth does it manage to do that so quickly? Let's get into the mechanics of how this powerful breathing rescue actually works.
Okay, so it's given as an inhalation, which means it goes straight to the source, the lungs. Once it's there, it targets these little docking stations on the lungs' muscle cells called beta-2 receptors. When the drug latches on, it sends a massive signal telling the muscles around the airways to just relax. It's kind of like unpinching a drinking straw. All of a sudden, that passage opens right up, the swelling goes down, and air can finally move freely again.
And the speed, wow, it's just incredible. We're not talking about waiting 20 or 30 minutes. The effects start kicking in within about 5 minutes. In a real breathing emergency, 5 minutes can feel like an hour, so that speed is absolutely everything. Now here's the catch. While it works incredibly fast, its effects only last for about 1 to 3 hours. And that pretty short window is so important to remember. It means the relief is temporary, and you have to watch the patient like a hawk, because those scary symptoms can come right back.
So, knowing how it works, when do we actually pull this tool out of the toolbox? What are the green light scenarios where this is exactly the right call?
Its main claim to fame, for sure, is treating croup in kids. That's the source of that barking seal cough. But it's also a go-to for major swelling in the larynx, what we call laryngeal edema. And it can be a lifesaver for a severe bronchial asthma attack, or any other situation where the airways just suddenly slam shut.
Okay, but with any tool this powerful, you know there are going to be some serious risks. So now we have to talk about the red lights. The situations where this drug is the wrong choice, and the warnings you absolutely cannot ignore.
This slide really lays it all out. On the left, we've got the situations where it helps, but on the right, you see the absolute do not use cases. It's a no-go for patients with high blood pressure or any underlying heart disease. And this is critical. You do not use it for epiglottitis. That's a totally different kind of airway emergency that this treatment can actually make much, much worse.
And since it's basically mimicking adrenaline, you can probably guess where the main side effects are going to show up. The heart. It can cause tachycardia, which is a really fast heart rate, and dysrhythmias, or irregular heartbeats. This is exactly why monitoring vital signs isn't just a suggestion, it's non-negotiable.
It also doesn't always play well with other medications. For example, some older antidepressants, called MAOIs, can ramp up its effects to a dangerous level. Beta blockers, which are super common for blood pressure, can basically cancel out its benefits. And if you mix it with other stimulants, you're just asking for serious heart rhythm problems.
And here's where things get really weird, a true paradox. The very drug you're using to stop a bronchospasm can actually cause one if you overuse it. This is a classic case where more is definitely not better. It can be a whole lot worse.
Remember how we said it wears off pretty quickly? Well, here's why that is such a huge clinical concern. After those couple of hours, the symptoms can come roaring back, and sometimes they're even worse than they were before. This rebound effect is why a child who seems better can't just be sent home. They need to be observed to make sure they're truly in the clear.
So, with all these potential pitfalls, how is it used safely? Well, it all comes down to two things: precise application and getting the dosage just right.
As you can see, the dosage is definitely not one size fits all. For an adult, you dilute the standard dose and give it over about 15 minutes. But for kids, the dilution is different, and there's a specific protocol for giving a repeat dose if things are really severe. Precision here is everything.
There's also a really important special consideration for pregnancy. This is not something you'd use for routine day-to-day asthma control. But in a severe emergency during pregnancy, it can be used to reduce the risks to both the mother and the baby. It's a very specialized tool for a very specific, high-stakes moment.
All right, so let's boil this all down. What are the key takeaways? First, this is a rapid-fire rescue drug for airway emergencies, especially croup. Second, the heart risks are real and they are significant. Third, monitoring isn't optional, it is absolutely mandatory. And finally,
Getting that dosage exactly right for the patient in front of you is critical.
And that really leaves us with the big central question, doesn't it? For a drug that is this fast and this effective, how do we best balance its incredible life-saving benefits against its very serious risks? Finding that perfect balance, well, that's the key to using it wisely.